Hi, this is Colleen Parsons with your health assessment lecture on eyes and eye assessments. Review your anatomy and physiology of the eyes. It's very important, especially all of these are. There's nothing that's not important. Your anatomy and physiology should be coming into good use here. In your health assessment of the eyes, well, in all of your health assessments, down here where it says 2 comprehensive questions, this is where we're going to exclude that, and that's where you're going to be giving me the ISBAR for your eye assessment and for all of your skills assessments. So looking at the external anatomy of the eye, we are looking at the shape of the eye. Are they symmetrical? And when you actually get to the point where you're palpating them, you're looking to make sure that there's no pain and tenderness there. You'll be doing those things at the same time when you're in practice. So you'll quickly look, you'll have some experience of what you're looking for, and then you'll quickly go to the palpation while you're also asking your health history questions. That all comes together. One of the most important things that you look at when you are examining the eye is, do they approximate? Which means, do the eyelids of the upper lid and the lower lid close completely so that there is none of the actual eyeball showing? The reason that that's important, it's especially important for patients who are undergoing surgery, especially general anesthesia, and for patients who are older or have any kind of swelling in their eye at all that prevents them from closing. Because if they can't close their eyes and part of the eyeball dries out, that can lead to lesions or abrasions on the eye, and that isn't good, and sometimes those can be permanent. So we want to help our patients protect their eyes as much as possible. We want to pay attention to all aspects of the external eye, and the lacrimal duct, which is your tear duct, is a very important part. Your muscle attachment with the optic nerve. Your muscle attachment is important because that's how the eye moves so that it can see. And the different directions, the 6 cardinal directions that the eye needs to move. When we're checking a patient, we're going to go up and down and side so that we can see that the eye is moving completely and all the muscles are intact and all the cranial nerves are intact that make the muscle move. When we can detect problems in very young children, we can help correct them early. So for instance, we didn't used to know how to correct lazy eye early on, where one of the eyes has difficulty focusing, and we know now that in some patients, when we can correct that with surgery, they don't have to have that stigma, or they don't have to have lifelong problems with a wandering eye. Did your mother ever get mad at you for rolling your eyes at her? I used to tell my kids that their eyes were going to stick that way. Okay, so in cataracts, this is a normal eye, and you can see how cloudy this is right here on the pupil. That becomes more and more cloudy as we age, beginning about the age 40, and will continue until, well, in today's day and age in the United States, and until the patient is having a very hard time seeing, and then they will undergo cataract surgery where that cloudiness is plucked and a lens is put in. It is important to understand cultural competence because everybody's eyes are different. They have different needs. Here are 4 people with glasses. We've got, maybe she's wearing contact lenses. Maybe she's got cataracts. We have different eye shapes. Sclera, the white part of your eye, for dark-skinned people can appear a little bit yellow, and that's totally normal. Those are all things, and the shape is different, and how culture views eyes. Some cultures encourage, like in our culture, Western culture, we encourage direct eye contact. Other cultures, not so much. Especially women are not supposed to make direct eye contact. So if you have a female patient, she's not making direct eye contact with you, it's important to have a little bit of an understanding about her culture. We want to know as much subjective data about the eye as possible because that will determine what's going on for our patient. Glaucoma has a tendency to be hereditary, so that's important. Is there any pain or tenderness? Has there been any vision difficulty in the patient? How about any discharge, any watering of the eye? Does the patient have corrective lenses, either in glasses or contact lenses? And how do they take care of their eyes or contact lenses, for instance? I used to have a friend who would just lick them off and put them in her eye. So pay attention, very close attention, to all of these subjective questions for the health history questions for your patients. And of course, we're always asking about pain or tenderness, redness or swelling, any history of difficulty. And the only sure way to detect for glaucoma is by when you go to the eye doctors and they test the pressure of your inner eye. That's what is causing the glaucoma, is the duct has become sealed in some sort of a way and it's causing significant problems which can lead to blindness. Now, one of the ways that we can detect for glaucoma, or at least through your health history, and if this is a serial visits, meaning the patient has come before for their initial visit, and this is a repeat visit, maybe annually or something, if there is a loss of peripheral vision, and especially if it's a consistent loss, there might be one of the slower glaucomas going on. It could be a dramatic, all of a sudden the patient doesn't have peripheral vision, has pain in their eyes, and that becomes an emergency situation. Here's how the pressure builds up. And you might even see a slight bulging of the eye, but I would suspect especially in a new nurse whose where eyes aren't your special area of specialty, you're probably not going to notice that as quickly as somebody who is used to looking for the slight bulging of the eye. So how do people take care of their eyes? That's all important. Additional history for infants, it says, and children, but with infants we're looking at, was there anything at the time of delivery that we should have paid attention to that perhaps we didn't? And for children, do they know how to take care of their eyes? Do you watch what they're playing with so they don't poke themselves in the eyes? And those of you who have watched, what's that movie? A Christmas Story, don't shoot your eye out. As I was growing up, that was something my parents said especially my mother said all of the time. But it wasn't just her, it was all of our mothers. Additional history for aging adults. Aging adults have much more difficulty with their eyes, from cataracts to glaucoma to dry burning eyes to loss of vision, especially with night vision. Some people shouldn't be driving at night at all because they lose the ability to see clearly with decreasing light. There's cataract. The side has been probably surgically repaired, and this side needs to be repaired. That's the end of part 1. Thank you.